On June 27, 1932, a small group of African-American sharecroppers in Macon County, Alabama, unknowingly stepped into a nightmare that would last 4 decades, a nightmare that would become the infamous Tuskegee Syphilis Study. What began as a public health effort to observe the natural progression of untreated syphilis quickly morphed into a grotesque experiment that sacrificed the lives, health, and dignity of 600 black men at the hands of the United States Public Health Service. The backdrop was a rural South still reeling from the Great Depression, where poverty, limited medical access, and segregation were the norm. Syphilis, a sexually transmitted infection that could cause blindness, paralysis, and death, was rampant among sharecroppers who lacked regular health care. In the early 1930s, physicians believed that tracking the disease's untreated course could reveal crucial insights, even as the world was on the brink of discovering penicillin, an effective cure that would soon render the study's premise obsolete. In July 1932, the Public Health Service, in partnership with the Tuskegee Institute, recruited 600 black men, promising free medical examinations, meals, and a burial stipend. Of those men, 399 were already infected with syphilis, while the remaining 201 served as healthy controls. The men were told they were receiving treatment for bad blood, a colloquial term that encompassed a range of ailments, but they were never informed of their true diagnosis. Even after penicillin became the standard of care in 1947, the study's leaders deliberately withheld the drug, rationalizing that the experiment must continue undisturbed. For years, the men endured invasive procedures, blood draws, spinal taps, and periodic examinations, while their spouses and children suffered the ripple effects of an untreated disease that could be passed congenitally. The study's architects, including Dr. Taliaferro Clark and later Dr. John Heller, kept meticulous records, documenting the progressive damage to the participants' organs, the onset of neurological symptoms, and the heartbreaking loss of unborn grandchildren. All the while, the men believed they were being cared for, unaware that their suffering was a calculated data point in a government-sponsored experiment. The veil of secrecy began to lift in the early 1970s, when a whistleblower, Peter Buxton, a public health service analyst, leaked a copy of the study's files to the press. In July 1972, the Associated Press ran a front-page story exposing the truth. Public outrage erupted across the nation, prompting a Senate hearing led by Senator Edward Kennedy. The hearings revealed that the study had continued for decades after a cure existed, that participants had been misled, and that the government had knowingly allowed preventable deaths. The Senate subcommittee's final report labeled the experiment unconscionable and inhumane. When the study was finally shut down in 1972, the surviving participants were finally offered penicillin, but the damage was irreversible. Over the next several years, forensic pathologists performed autopsies on the deceased men, documenting the severe organ damage, cardiovascular deterioration, and neurodegeneration caused by untreated syphilis. These post-mortem examinations not only confirmed the grim clinical observations recorded over the years, but also served as a stark, visual testament to the human cost of the experiment. The bodies, once treated as data points, became silent witnesses to a breach of medical ethics that would haunt the nation for generations. The aftermath reshaped the landscape of biomedical research. In 1974, the National Research Act established institutional review boards to protect human subjects, and the Belmont Report of 1979 codified the principles of respect for persons, beneficence, and justice. In May 1997, President Bill Clinton formally apologized on behalf of the United States, acknowledging the profound betrayal of trust. Yet the legacy endures. Mistrust of the medical establishment among African American communities, higher rates of vaccine hesitancy, and ongoing debates about the ethics of human experimentation. The Tuskegee Syphilis Study stands as a cautionary tale, a stark reminder that science divorced from compassion can become a weapon of oppression. It forces us to confront the uncomfortable truth that progress built on the suffering of the vulnerable is not progress at all, but a moral failure. As we look back on the men who were promised care but given only exploitation, we are reminded that vigilance, transparency, and accountability must remain the cornerstones of every medical endeavor. Subscribe to the Autopsy Files for more medical history stories.